Hello, everybody. Welcome to another episode of the Intelligent Speculation Podcast. My name is Dr. Patrick Maloney. Just to remind everybody, I am a PhD level epidemiologist. I work with the Centers for Disease Control in the Dominican Republic field office. I mostly manage the COVID-related scientific activities, and I also assist in HIV/AIDS programming. And today we have an excellent guest that I'm very excited to have on. By the name of Donna Bean. Donna works with me in the CDC Dominican Republic field office. She's a global health epidemiology fellow through the PHI CDC fellowship program. Donna has her BS in nursing from the University of Miami and her master's of public health in epidemiology from the University of Arizona. She's been working in public health for more than a decade with experience in HIV/AIDS, tuberculosis, and COVID-19 control. Donna served 3 years in the US Peace Corps in Mozambique as a community health promoter focused on HIV, TB, and malaria. She worked as an HIV tester and counselor in Miami-Dade County, which is in Florida, and participated in the HIV or the University of Miami led HIV research in the Latin American community in Miami. She participated in the NIH's MHIRT fellowship in Alicante, Spain, which resulted in a political epidemiology global analysis of national legal structures and their influence on maternal mortality rates. She worked for 5 years as a public health nurse on vaccine preventable diseases and TB case management, serving Indigenous communities throughout Southwestern Alaska. And most recently, prior to the PHI CDC fellowship, she was an infectious disease nurse consultant for the state of Alaska's public health effort in controlling COVID-19 outbreaks via contact tracing. So welcome, Donna. I know it's a little bit weird reading through the bios and getting like your whole 10-year career just sort of distilled into a single paragraph. So thank you for bearing with me through that.
Yeah, that was a lot all at once. I was like, oh, right, I did that.
Yeah, I know. Sometimes I look back on, my public health career and like these like incredibly meaningful experiences that I had, like living abroad in Central America and, participating in these massive public health programs. It's just like when you talk about them or like hear it, it's just like, it's so devoid from like that massive impact it had on your life.
Yeah, it sounds really good, but also overwhelming. And then you remember like the dirt on your feet or like the smells or how hard it was to get there.
Yeah. I remember all of those things just so vividly. Like sometimes it'll just like come back at me at like the weirdest moments and just sort of hit me like, and even as like massively uncomfortable as working in these types of places can be, like in Mozambique and rural communities and everything like that, or for me working in rural communities in Latin America, it's just like the most meaningful experience that I had in my lifetime, at least.
But no one tells you about the amount of sunblock, sweating, and like bug repellent.
Yeah, when I was in Central America, I got dengue when I was in Nicaragua, and it was just awful, like truly awful. So yeah, I am well accustomed to that sort of level of discomfort. But so Mozambique, that was your first international experience with the Peace Corps. What exactly were you doing out there?
Well, it wasn't my first international experience. Before I went into science, I was actually very much social sciences. Like I double majored in sociology and history, and I actually worked in Tanzania 2 summers. But that was microfinance. I did a microfinance fellowship. So kind of sort of related, not really, development-wise, I guess. But in the Peace Corps, yeah, I was not supposed to go into health. I was supposed to go to West Africa, French-speaking West Africa, for a microfinance post with women. And then as luck would have it, my medical got delayed and I was already interested in public health. And they were like, well, French, how about Portuguese? That's close enough. Do you want to go to one of those Portuguese speaking countries? And I was like, sure. So I ended up in in Mozambique as a community health promoter, so primarily HIV.
So
Um,
when you did Mozambique, you already had your degree in nursing, or you went
no,
afterwards to do your degree in nursing?
I got my degree in nursing after. Yeah.
So you
Pro-
had a pretty drastic change in your trajectory based on your experiences in Mozambique. That's what sort of sealed the deal for you for going into health.
Yeah, a lot of people thought in my village that I was, because I was a foreigner, that I was either a nurse or a doctor, and
Yeah.
would come to my house asking for help. And I would like feverishly look things up in my onde não há médico, which is where there is no doctor, but in Portuguese. And like, I don't know what to do for a scorpion bite, but here's some Tylenol, which I wasn't probably supposed to do in retrospect. Yeah, and so nursing was the was the quickest way, least expensive way to get clinical experience, and then couple that with public health, like with a master's in public health, to do this work.
See, that's so interesting because my career trajectory, I was on a very similar trajectory as you were. I studied political science in my undergraduate degree, and always had this idea that I would work on maybe international development or something along those lines. So that was my interest, that or law or something along those lines. But then I went to Central America, and I came back with just like this renewed sort of worldview, I guess, that I just realized that, for me, working with people on the ground and making individual differences in their lives was something that I was just very interested in doing. So I came back with the idea of going to med school, but I did my master's degree in epidemiology, fell in love with it, and then just sort of, continued that journey for myself. So it's really interesting because I feel like if more people had these sort of experiences, like we're able to go out, go abroad, work with real people, I think it sort of humanizes the suffering that you hear about in the news or that you read about or anything along those lines. I think that people can just so easily like disillusion themselves or like distance themselves and be like, well, these aren't really like my problems, or these aren't really that bad. It's just when you hear, like for COVID, for example, when you hear like the numbers of people who have died or the numbers of infections, like those are just abstract numbers, right? It's like when you really like meet people and, sharing their pain, sharing their suffering and their journeys, that you sort of get this changed, like divergent perspective, I guess.
Yeah, I mean, for me, my focus has always kind of been on women. In terms of health, obviously providing health to everyone, but like women and children, especially around the world, don't have as many rights. When I was studying microfinance, I wrote a thesis for my sociology degree, comparing Kenya and Tanzania, and how in most African countries, women cannot legally hold land or inherit land, even though they often do a lot of the work. So that, and then just like my own family story with my mom, having been an immigrant and crossing without papers from Mexico. That was what inspired me to go to Peace Corps. And even if you don't have financial means, unless you have to stay in the States and maybe help out family members with real money, because I was only making $200 a month. If you have student loans, they are now Peace Corps has finally gotten with the times, and you can count those 3 years or 2 years of service towards loan forgiveness programs. And I hope the 10,000 comes through, although I wish it were more.
Yeah, I'm on board with you there. For those of you who don't know, or who are just, starting out on your college journey, there's a program called the Public Service Student Loan Forgiveness Program, the PSLF. I think I said it right. But essentially, you make 120 qualifying payments on an income-driven repayment plan, and after those 120 payments, one a month for 10 years, you actually get the balance or the remainder of your loans forgiven. And public health is a great field to go into to pursue that, because you work with a lot of local, state, national governments, nonprofits, and so on and so forth. So Excellent, excellent program. But I'm glad that Peace Corps is finally counting those 3 years towards public. I mean, because there are very few things that are more public service oriented than like
Right.
Peace Corps or AmeriCorps or something along those lines, where you get a very tiny stipend. And what is it? Is it like a one-time payment when you're done of a few
Yes.
$1,000s?
They finally updated it. I think it's still under 10,000. But back in the 60s, because Peace Corps was founded in 1961, it was supposed to pay, it was like around $5,000, and it was supposed to pay for grad school and like help you readjust back to the
If only grad school cost $5,000. Oh man.
Yeah, yep. And then I think when I left, I got around 5,000 or 6,000. Plus I cashed in my plane ticket value, and then that got me through. But yep.
That's just such craziness. So so with all that in mind, do you see like Peace Corps as like a viable option for somebody who doesn't come from money, like somebody who's out there supporting themselves, just gets out fresh from college, like doesn't, you know, have much savings? Like, is Peace Corps something that would be viable for somebody like that? Like what tactics would you use to actually
Right.
survive in the program?
Well, I'm not a financial advisor, but
this is not financial advice. Throw a little Chiron at the bottom here.
So, I mean, as long as you don't have credit card debt that's going to continue to accumulate while you're gone, if all you've really got is the only financial obligations you have are student loans, I think it is feasible. Unless, you know, you really can't afford to miss out on real income. But I think that it's an invaluable experience. I've never regretted doing it. And you make a lot of long-lasting friendships. I still text almost every day with one of my best friends from Peace Corps. And you learn a lot from your cohort, because most people do end up going into either education or public service in the form of public health, or international politics, diplomacy. Know people at the World Bank now, et cetera. And it's really interesting to see where people go. And then you can kind of also learn what maybe not to do, or where you could potentially go in the future. For example, and this is money related. I have a lot of friends who did end up going to East Coast schools, and they're excellent schools, right? Johns Hopkins, Emory, Tulane, even though that's not technically East Coast, but and they did walk away with a massive amount of debt. I ended up choosing to work full-time as a nurse and take courses online, which maybe wasn't always ideal, what everyone's doing now. And I was able to pay for that out of pocket. So, but I kind of learned, I saw what other people had done. But anyway, yeah, I do think that Peace Corps is, if you're smart about it, you can do it and learn a lot, and not go into massive debt.
Yeah, I mean, you bring up so many like interesting points or ideas, like especially with the, you know, with the sort of educational trajectory that people take, because your route was a non-traditional route, but I would say one that was very effective, because being able to come out with not much debt, not being saddled with the burden of crippling debt, like you're able to branch out and you're able to pursue different opportunities that you might not necessarily be able to otherwise, like if you were saddled with like a huge amount of debt. And that's especially important for people who go into public service like us, because unfortunately those first few years you are not making great salaries,
especially not in a fellowship.
Yes. Yeah. But yeah, so I mean, that raises a great point. And I think that education is certainly valuable, and I would advocate that people do pursue education, but finding ways to do it cheaply or alternative methods to do it is just really, really important. Like, I wish that I could go back to my 18-year-old self with all the knowledge that I have now and just smack myself upside the head and give myself some like different like advice on what to do, because I definitely didn't manage or handle things like as good as I would have liked to. But I did make some like wise choices. Like did state schools for grad school and everything like that, got
Right.
in-state tuition and all of those sorts of things, and pursued fellowships and internships and got tuition waivers. But yeah, I think that there are ways to pursue higher education that don't, that doesn't put you in a massive amount of debt. But it's just so important because there's such an anti-intellectual movement in the United States right now, an anti-education sentiment. And I think a lot of that is fueled or is used, or this is used for fuel in that argument that school is so unaffordable nowadays. So
Right.
they're like, why go if it's so unaffordable? And you're coming out and, these entry-level jobs are paying you $30,000 or $40,000 a year or whatever it may be, So yeah.
The uniquely American problem.
I would say absolutely uniquely American problem. We have a lot of uniquely American problems that have been getting a lot of press lately. But yeah, education is certainly one of them. But yeah, and like you were mentioning before, the $10,000 loan forgiveness that's being discussed would be excellent. But for many students,
a drop in the bucket for a lot of people.
Yeah, for many students, it's not going to be that much of a difference, unfortunately. But okay, so you come back from the Peace Corps. Mm-hmm. You decide to get your BS in nursing. Did you have to do another 4-year degree, or were you able to build on your old degree? Yeah. Okay. So it was like a program or something like that.
Yeah. I actually looked into med school, but I was trying to go to med school in Mexico.
Really? That would be cool.
My family in Mexico. Yeah, I have a cousin who's a dermatologist. But I needed to get my Mexican citizenship, and there was it was a really long process. And I had to go to Mexico and get my mom's birth certificate, which was handwritten in cursive, and yeah, and they had to hand stamp it, and it was, oh my God. But it didn't end up working out, which I guess that's a good thing. I do enjoy being a nurse, but I ended up doing an accelerated bachelor's in nursing program through the University of Miami, which ends up being a 1 calendar year program.
Oh, excellent.
My cohort was very gifted. A lot of them already had masters. I did have to take prereqs that I hadn't taken as a social sciences major, like organic chemistry and lab. And I had to take psychology, which I appreciate, anatomy and physiology, which I did at a state school, or a community college after work. And then it was a 1-year program. I got a scholarship, but I still had to take out a Sallie Mae loan because at that point I had maxed out all my bachelor's loans.
No, really?
Because I did a little over 4 years to finish my degree. And they weren't, so I had to take a private loan, which I paid off as soon as possible. God, that was an over 8% loan.
That's crazy. Yeah, wow. That's an insane interest rate. I mean,
they didn't give me enough loans to cover my full year. And so they gave us a discount. The reason it's actually really insane to do a nursing degree in a year, I would at least go with at least 18 months. At the end of this year, I got shingles. So I took my NCLEX with shingles.
Oh my gosh.
It was very stressful. You still have to do the full clinical hours. So yeah, it was a lot. I learned a lot though. And everyone that I know has done really well afterwards, but 1.5 years is probably more reasonable, and it's still a very short amount of time. Mm-hmm. If you already have a bachelor's, right? Because you've got the 4-year degree already. But yeah, no, during that time I worked a little bit. I was a Peace Corps recruiter on campus. Nice. And then I became certified as an HIV tester and counselor, and was working a little bit with one of the HIV NGOs in Miami. And that was great.
Yeah, I mean, the nursing route is just such an excellent path for so many people, because if you've already got a bachelor's degree and you're unsatisfied with what it is that you're doing, you can go back for 12 or 18 months and start out immediately in a career that is rewarding. You get to work with patients, you get to work with people, you get to make a difference, and you get to make a lot of money, especially in the COVID era with in the era of traveling nurses, right, and everything like that, and contractual or temporary contract nursing and everything like that. It seems like a great path for a lot of people.
It is if you're not squeamish. Yes. But I do think that one thing that nursing school really emphasized that if anyone is watching that was considering nursing school, and this is what I tell a lot of people, it makes you feel as though you have to work in a hospital or you're not a real nurse. But clinic work is valuable. Working in STI or family planning clinics, going into some sort of teaching, working in a nursing home or a skilled nursing facility, these things are still viable. I ended up going to be a public health nurse, and I worked very closely with the nurses in the hospital, but I didn't have to work in a hospital. That kind of schedule doesn't always work for everyone. And sometimes, and I wanted, I ended up getting a sort of nursing residency. Some hospitals offer that, not all of them do, but where you are given more training past like 4 to 6 weeks. I know a lot of people who are hired out of nursing school and were expected to just start working. But you do need some more guidance. Just like with most careers, you have a transition period or probationary period, and you're given some sort of like onboarding plan and training. So looking for nurse residencies, I think that's a very valuable thing to do as well.
So you went directly into public health nursing. You didn't work in a hospital. So could you describe what public health nursing is, what it entails? And second, did you have struggles with your own identity as a nurse by pursuing public health nursing and not working in a hospital?
I think, great. These are great questions. So I think, yeah, I did struggle, actually probably later. And it's more recently that I've struggled, because I did end up working in a hospital for 6 months during COVID last year. But I always knew I wanted to work in public health. Like before I even did Peace Corps, I was like, I'm gonna get my master's in public health. It took me 10 years, since I started Peace Corps, it was almost 10 years to get my master's, because I went the nursing route first. And then the one thing you find is you keep sort of climbing the education ladder and trying to achieve, or get to the plateau where you're like, finally, I'm going to do the thing I want to do, my dream job. You realize you don't have the 3 to 5 years experience. You need another degree. You need another certificate.
A fellowship, something.
A fellowship.
It never ends. Yeah.
It feels like that. So trying to be okay with where you're at, and just always remember to put it in perspective. But public health nursing is nursing that provides services to the individual, a community, but then also works on systems level change. So the best way I can explain it is probably just telling you what I did. So I worked out of a clinic, and my first year was based mostly in a clinic that provided public health prevention services. So we work mostly in prevention and screening, like primary and secondary prevention. And a lot of it was infectious disease. So a lot of sexually transmitted infections, tuberculosis, foodborne illnesses. We had a lot of those, botulism every now and then.
One of the few places in the world you're going to find botulism nowadays, in Alaska.
Yeah, so one time it came from an event where someone had brought whale meat, like a whale meat salad, and I guess it had sat overnight or throughout the day when there was sun. Anyway, yeah, and so based out of that clinic, my first year of residency, I learned pediatric vaccination schedule. I learned how to perform physical developments and developmental screenings on children. So those are things that nurses, quote unquote, hospital nurses may or may not do. But a public health nurse is more of a generalist. So I had to learn infectious disease. I had to learn case management. I had to learn emergency preparedness. I had to learn pediatrics. I had to learn adult infection control. And so, whereas in a hospital, you're assigned to one floor or one unit. So if you're an oncology floor nurse or a med-surg nurse, you're focused on either cancer or like chronic disease and recurring infection patients. So you're really good at one thing, unless you're a float nurse, and then you kind of get thrown all over. But yeah, it's a niche thing. And public health nursing, you're never bored, because you run the full gamut. You might not like some of the work that you do. You might not like case management, but you don't have to spend all of your time on it. And then there's a healthy mix between like being in an office and needing to document and work on paperwork and chart and then also getting to be out in the field. And public health nurses get to do all over, not just Alaska, but you get to make home visits. You get to go to local shelters, community organizations, provide education. I would go to schools and provide education if they didn't have a nurse, to provide that health or sex ed education. That's a
What about your work with Indigenous communities?
Right.
Because that evolved into being a big part of your day-to-day work and everything, right?
Yeah, so where I worked was Bethel, Alaska. People can look it up on the map. It's 400 miles due west of Anchorage, so closer to Russia than the rest of the US. And it's actually, so we service an area, it's between the two rivers, the Kuskokwim and the Yukon rivers. So it's in a delta, an area roughly the size of the state of Oregon, and it's mainly Yupik and Chupik peoples, and some Athabascan tribes as well. And so it was majority, well over the majority, I would say like 90% was Alaska Native populations. And so there were about 45 villages that we traveled to in that area the size of the state of Oregon, and we'd have to fly on planes to go out to these villages that ranged anywhere from like 100 people to like 1,000 people. And all of this was on Alaska Native land, which was, it's all tundra and permafrost. So there's no trees and the ground sort of shifts and there's a lot of snow and ice and darkness.
Yeah, so to reach all of these disparate communities across this area the size of the state of Oregon, that like you're going through the tundra, the Arctic tundra, so it's not exactly like there are roads, you can't drive, so you're just flying in like float planes or snowmobiling, like that's like the primary mode of transit to get to these communities.
Yes, float planes sometimes. That's more Southeast Alaska, where you have more lakes and it's like not as frozen. Where we were, sometimes in the winter, the river froze over and you could drive on it. So you could make short, like shorter trips, but not all villages are connected by the river. So it's a 6-seater, usually a 6-seater Cessna, a 207, 208. Yeah, and then snow machines was part of it as well. Yeah, 4-wheelers sometimes, or ATVs.
So what was the degree of contact between the individuals you worked with and like the outside world? So like, what was it like when you landed in one of these communities that were like 100 to 1,000 people? Did they interact with other communities? Were there other communities around them?
Yeah.
Or was it in like were they like isolated by their geography?
Some were isolated, but no. So like Yupik and Chupik peoples, they were more nomadic before the Russian missionaries and traders came, and then later the Catholic missionaries. And there's like a ton of missionaries that came to Alaska, and then the U.S. government sort of made people settle into fixed locations, which is not part of the culture. But no, so people did do a lot of what we call, like, I mean, you know what potlucks or potlatches are? Mm-hmm. They were much more elaborate before the Catholic Church kind of like shut it down back in the 60s and set up boarding schools. But yeah, communities with potlatch. So there are like networks, those networks still exist. Like I could think right now in my head, there's like Scammon Bay, Chivac, and Tuluksak, that like are 3 villages that are right pretty near each other. Some of them share fish camps. So like in the summer, people would go fishing, and the fishing camp or like their summer houses wouldn't be in the village. It'd be at a better, obviously ideal fishing spot. And sometimes that's how you'd see other communities. But yeah, it was, I mean, it's really expensive and cost prohibitive to fly in between villages. So for like a 45-minute flight from my home base of Bethel, round trip to a village, 45-minute flight, $600. Where someone in Anchorage could get a round trip flight to Hawaii for $600. So people are kind of financially trapped. So unless you've got like business and someone else is paying like your work, or, I mean, unless you've got a really lucrative job, you're probably not going out of town unless it's for medical reasons or school.
Yeah, that makes sense. So do the economies there function differently than the sort of external like US economies like at large? Is it like are people is it more of like a supportive type of community, I guess is what I'm trying to say. Like, are people trading, sharing like resources, food, fish, like all of these sorts of things? Like how are people socializing? How are people like getting goods, buying goods? Like are things imported from, you know, other parts of the country? I mean, how do they get like essential commodities, I guess, is another
Right.
question.
So yeah, a lot of it has to be imported, but at least in Alaska Native rural communities and areas, there's permission given for subsistence. So you don't need a permit to hunt and fish within, you know, the seasons. Like in the fall, you have moose hunting season. In the summer, it's salmon and a lot of different fish. Up north on the coast, there's only about, I think, 12 tribes that are legally allowed to hunt whale. But you can hunt seal, caribou, et cetera. And if you take one of those down, like that's a lot of food to process and keep. So deep chest freezers are very important. In the winter, obviously the snow helps. But no, a lot of stuff is imported. Extremely high prices. Take anything in lower 48, which is what we call the continental US, the contiguous US, that triple the price of anything. You know those little cuties, like a bag of cuties, a little mandarin or
Okay.
I've seen them for like what, $4 or $5.
Yeah, something like that, probably.
Something like that for like a 3-pound bag. In villages and in Bethel, I would see them for $20.
Wow.
I honestly, it's not till I've gotten here to Dominican Republic that I've started to eat fruit regularly again, because I just kind of like cut it out of my diet because it was so expensive, and then it wasn't even always great quality. But in the summer you could berry pick. So yeah, there's like berry picking, hunting, subsistence that helps to supplement, because it's very costly unless you've got a child and maybe you've got WIC. There was TANF, temporary assistance for needy families. You got SNAP, the nutrition assistance program. There's a lot of those kinds of programs that help provide food, but the stuff that's going to last long on the shelf, you know, you've got like dried goods like pastas and canned goods, which have a lot of sodium. Actually, soda pop or whatever you call it ended up being cheaper than water if you're going to buy a liter of water versus a liter of soda. So there's a lot of like dental caries. Water in Alaska in most places isn't fluoridated. There's like a ton of public health work. So if anyone listening wants an adventure in like snow sports, Alaska's a great place to do public health work. Pays well, you learn a lot. It's very meaningful. Yeah.
It's almost like the whole, like what you're describing is like the food deserts that we experience here in like the US. And for, you know, people who are listening who may not know, food deserts are areas where having access to fresh food essentially is something that is severely limited or restricted. You have to go a significant distance away to be able to access things that are fresh, like fruits and meats and all of those sorts of things. And essentially what you're encountering then is you're encountering these ultra processed foods, which are linked to all sorts of health conditions like diabetes, obesity, cardiovascular disease, all of these other sorts of things. So there are places like in the United States, in what is supposedly the richest country in the world, where it is still difficult to get those essential dietary foods that you need to exist. That's so interesting and so wild to me. But so when you went into these communities, were the programs that you were implementing like already established, or were you reaching out and were you making new connections to try and sort of enhance public health within the communities that you were working in?
So in most of these places, most of these villages, there were both tribal and city councils. In some places, there were multiple tribal councils because there were multiple tribes. So there's actually like more recognized tribes than villages. There's like 50 something tribes. And I would make the rounds. I'd usually stay about a week. But public health nursing in Alaska has existed for least, I mean, we didn't become a state till the 50s, but it's been around since the inception of the state. And we actually, as a state, were one of the last to continue fully funding a public health nursing program. We did experience cuts ourselves these last few years, but most other states have gotten rid of it. And in the last 20 years, there's been a shift in thinking, and people are wanting to bring back public health nursing because, I mean, you know, the healthcare system in the States is much more based on a reactionary system versus a preventive system. And it's actually just, you know what, no matter what you think about healthcare, it's cheaper to prevent something than to have to pay for the consequences. So a lot of states have started reinstating public health nursing programs. So ours never went away. So we've always had that infrastructure. And then especially in a place that is rural, and you become very tight knit when there's like a lot of survival happening, right? And you're exposed to like death and hunting and bear maulings and a lot of different sorts of scary things. So no, I could vow, I was sort of like Peace Corps, where the nurse who came before me that was assigned to that village, I'd be like, oh, I'm the new Mary. And they're like, oh, okay. Or you're young Wilma, you know, my name's Donna. So you're kind of going off of the goodwill that was forged by the person before you.
So you're really already incorporated then in the regular lives of people in these communities. So when you go in, you're not viewed as like an outsider or something along those lines. Because I
was an outsider. You know, I would consider myself more Alaskan now than anything, although I'm from California. But yeah, I mean, I live in Bethel, right? I live in, so I'm not from the village, but it was good to be an outside party because I ended up being sort of like an ear to a lot of problems and venting that people couldn't do, because in small communities, and we know anywhere, you know, gossip and news, we call it chisme in Spanish, you know, that'll run around real quick. So it was nice to be able to provide like a confidential ear, although sometimes it gets overwhelming to hear all of maybe the issues that are going on at any given time. But I think it was like a plus to be an outsider at times.
Yeah. So how do you deal with that on a personal level then? And also on a personal and external level, like you hear stories of domestic violence or something along those lines. Like, how do you deal with that? How do you become okay with that? Because like my natural reaction always is, what can I do to solve this? And in these cases, it's not something that's like really, really solvable in many cases. So what do you do, one, and how do you grapple with the choices that you have to make as a result of these stories that you hear?
Yeah.
And it doesn't have to be just domestic violence, like anything that, you know, it is that you
there's a lot of substance misuse in the form of alcoholism. There's a lot of suicide. I think I've known more people who have completed suicide than anywhere else that I've ever lived was in Alaska. And that's documented phenomenon. But I had a therapist. I still have a therapist, but especially then, you know, accessing mental health, I had great health insurance then, maybe not so much now. And really, I mean, finding coworkers that you can confide in, you know, without divulging or violating HIPAA, being able to find a safe space to talk about it with, because everyone, you know, and it's not just Alaska. I think it's sort of you would make the same observation most places, even here in the DR. I've seen 2 dead bodies already here on the highway. And it's not, you know, death is not as sanitized and in most of the world as it is in the United States. Mm-hmm. And, you know, I've been to funerals in Alaska where you actually have a wake and the body is in the house, and you go into, and I don't really know many people in the States that do that anymore. I'm sure there's some religions that do. I don't really know. In your house though, you know, without.
I've only ever been in funeral parlors, I think. Now, I've never been in somebody's house for a wake, I don't think, in the US. Yeah.
and like I've been, yeah. So I guess just recognizing your fellow humanity, and you probably experienced this when you were abroad. You know, there's problems that all humans face that we don't really think about in the United States that often, and so it really humbles you, and you really just get down to like the actual essence of like what it is to be a human. And but yeah, not gonna lie, a lot of secondary trauma went, and I was actually, I think I was an EMT for a year, volunteer EMT, and most of what I saw was a lot of alcohol related injuries and domestic violence. And for me personally, like, well, like what you said, I wanted to do something about it. I didn't feel like I was helping to prevent the problem. I was just kind of like at the end of that chain of events. And so I actually ended up, for my own mental health, stopping that volunteering and focusing more on substance misuse education and like distributing Narcan and naloxone in villages, and working on mental health trainings, because yeah, you have to find what's going to be sustainable for you and your mental health.
Yeah, I absolutely understand. Yeah, and faced a lot of those difficulties on my own. And I feel like sometimes the best thing that we can do in those sorts of situations is just listen to the stories that people have to tell. Because I feel like that helps like immeasurably, like just being somebody that can be trusted and that, you know, is there and can make people feel heard, I feel like is very useful in itself, even if there is no like actual reaction that you can have or substantive actions that you can take. Like even just listening is good. But yeah, that it's just devastating, because it's like it's such a balance or it's such a line that you have to walk, because you don't want to write off people who are like already experiencing those things, but at the same time the best thing to do is focus on future prevention and education and all of those sorts of things, and harm reduction programs and everything.
Wait, what's that weird
it's very difficult
analogy where they're like the babies in the river, and you're like keep scooping out the baby in the river, and then someone's like, we should go up river and see where the baby's falling in? They use that analogy in public health all the time for prevention. I'm like, this is a terrible analogy, but yeah, exactly that.
Yeah, very true.
Yeah.
But so how was your experience living in Alaska in general? Like, because I don't know much about the size of Bethel. So was it a big city?
Right. Okay.
Did you feel really isolated? Because if you're 400 miles from Fairbanks, the biggest city in Alaska, I imagine it's a smaller place. You're talking about how expensive flights are. Like, so how was living in Alaska? Did you find it difficult? And sort of what steps would you take to you know, alleviate some of that difficulty, I suppose?
Right. So Alaska, the state of Alaska, is bigger than Texas. I really loved being able to say that. It's like 2.5 times larger than the state of Texas, not a large state. It's got roughly 700,000 to 750,000, I'm not sure these days, in the entire people in the entire state. So less than 1 million people in the entire state. And I know there's over 1 million people in North Dakota, right? Like, so it's very sparsely populated, right? The town of Bethel that I lived in was 6,500 people.
That's a really small pool of people.
Yeah.
That would be like a small community like here. Wow. Okay.
Right.
So 6,500 people.
Yeah. And so, even for us, it was hard to get groceries, and we're like a regional hub. So luckily Alaska Airlines, one of my favorite airlines, hands down, they have something called Club 49. So if you are a resident, you get 3 free 50-pound, what we have totes. So, you know, those like big plastic, like snap-on lid things you can get at Costco. We go to Costco and you go grocery shopping like all at once. And I would take 3 of them and I would just fill them with as much stuff as possible and fly them back.
You would fly to where were you flying to?
Anchorage, which is roughly an hour flight.
So you're flying to Anchorage with 3 50-pound totes, do your grocery shopping, and then fly back. So the normal American experience is you drive 15 minutes down the street to your local grocery store and you can get what you need. took a flight to get
so there were two grocery stores in Bethel, but like they didn't always have everything, and it's really expensive to pay, like I'm telling you, one avocado is like $5-6, a gallon of milk is like $10. So you're like, let me buy in bulk, let me go to Costco when I can.
No.
You end up getting a lot of Alaska Airlines miles. They do a lot of specials. They even have this thing where if you're an Alaskan and you have their credit card, you can get 2 people get the same round trip flight, and the second person only pays $99 in taxes. So you can both kind of afford to go somewhere that maybe has sunshine. It's cold. It's cold in winter for about almost 9 months out of the year. Summer is glorious and magical.
In winter, do you face the 24-hour nighttime or 24-hour daytime or anything like that?
I am not that. That's way further north. The latitude at which I lived most of the time was the shortest day was about 4.5 hours of light. So the sun would come out at 11, and then it would
11 in the afternoon to 4 p.m.
Yeah, to like 3. So yeah. You got to take vitamin D. So most people, even in the lower 48, they have vitamin D deficiency. So up there, I once had healthcare providers tell me like, it doesn't really matter. You can take like 10,000 in a week because you probably still don't have enough. I got a SAD lamp. So a seasonal affective disorder lamp, where you like set it up behind, ideally in your office, like when you're waking up, like behind your computer, and it just shines artificial light at you, and you kind of like your body thinks it's waking up. And to exercise, like you have to exercise. You have to get used to exercising in the cold and the dark, or like going for a walk, because if you're indoors all the time, it's not good for your mental health. But sometimes weather is not, the coldest I've been in is what, -50.
Yeah, I can imagine that all of those factors would definitely contribute towards ill mental health, right? I imagine that they would exacerbate conditions or cause new conditions. And I mean, a lot of people don't even feel like a lot of people can't even conceptualize what it would be like to just wake up and have there not be any sun, and wake up in the bitter cold in the dark and have to start your day. Like when I wake up in the wintertime in Chicago, I can't even be like bothered to get out of bed half the time, right? I got to hit the snooze alarm a few times. But I imagine if the light's not even coming up till 11 o'clock in the afternoon, I mean, it's that I can't even imagine being able to get up and function fully under those conditions.
And so I think that's, if we're going to bring it back to public health, well, like mental health and telehealth. Telehealth has been like very much pioneered in Alaska. There's still a dearth. There's not enough mental health practitioners anywhere. But for people who need it in Alaska, you had to make leaps and bounds in telehealth because you can't get to all these places. Yeah. So I ended up having therapy via Zoom, or not Zoom. It's a secure platform, but because otherwise, when my in-person therapist left, I was like, what am I going to do? And I got transferred to someone else, and thank God for that. Or even when I went to the hospital, because I ended up getting, I'm on anxiolytics. It's also an antidepressant, so 2 for 1. But when you take medication, I would have to go see like a psychiatric nurse practitioner in the hospital, but on a screen, right? Because they were in Montana. Because it's Alaska and you don't have people there in person.
So for anybody who's listening who may not know, if you haven't been able to pick it up by now, telehealth is essentially something that connects providers to patients electronically. So this would be, I mean, we were all pretty comfortable living in the virtual world right now, but this is something that's been taking place for many years before that on secure platforms that can connect patients and providers virtually, like via these type of Zoom calls, like only under different secure programs. So yes, very essential in many rural parts of the United States, including Alaska, which is essentially outside of a few cities. I mean, one of probably the most rural state that we have in the Union, and with the most disparate populations and everything. That I can imagine that being crucially important. So with the healthcare system in Alaska, are you asked to take on more duties as a nurse than you would anticipate taking on in other places? Because I imagine that the number of physicians in Alaska is probably disproportionately low. So the burden on nurses, or the expectation of nurses, is probably higher. Like, was that your experience out there?
Yes. Yeah, there's very low numbers, at least in rural areas, very low numbers of dentists, physicians, physician's assistants. So yeah, nurses well before me in like the 90s were doing pap smears, they were doing cultures, they were placing like Nexplanons, nurses and nurse practitioners. Legally we have, so the state of Alaska and its constitution, its not legislature, anyways, and it's so in its statutes, in its legal statutes, they've written into it that public health and public health nursing can take these extra steps and sort of expand your scope of practice. Like technically, so otoscope and ophthalmoscope, right? Those are
eye and ear scopes, right?
Yes, exactly. So I'm just screening for abnormalities. So I'm not diagnosing, but I'm screening for abnormalities, and that's not what regular nurses do. That's a nurse practitioner, mid-level and higher sort of thing to do. And then sometimes if I'm the only person in the village that has any clinical background, guess who is looking at that appendicitis scar to see if it's infected? Guess who's looking at the mastitis while I'm vaccinating your kids? It's me. So there's still like a little bit of everything. And like a lot of it was like, we should call a doctor. But there's also, because of the lack, so it's not just nurses filling this gap. There's something called community health aid program. And then there's also a dental health aid program. And it's unique to Alaska, in particular, the dental health aid program. The dentists try to get rid of it, but the Alaskan government saw that most dentists aren't moving to rural Alaska. So yeah, we're going to need some sort of capacity and human resources to fill cavities, to do cleanings, to diagnose, to be able to refer out and actually see people for when they have any sort of dental issue. So there are community health aides that practice at various levels, 1 through 4, and then you have a community health aid practitioner, and basically at the same level as a nurse practitioner. But they also rely on telehealth. So they'll call in a doctor if there's an emergency. They will FaceTime essentially a doctor and help them diagnose whatever emergency is going on until transportation can get there, which at times can take hours. Just like in the rural South, any other rural place, sometimes an ambulance will take hours, and you have to keep people alive for hours until they get to a hospital. So there's a broad network of other kinds of healthcare providers that fill the gaps.
So how does that deal with, or how do you all deal with like medical malpractice or like culpability for these sorts of things? Because I can see that being something that could potentially be an issue, right? Because nurses and community health aides typically don't carry the same level of protection as physicians do with those sort of medical malpractices. Yet you're being asked to perform some of the duties that physicians would normally perform. So do you have some sort of level of personal culpability for anything that may go wrong under these circumstances?
Not that I'm aware, like, let's see, I luckily was never in this situation. What little I do know is that for example, there are Good Samaritan laws in most places. Alaska is one of them. So if you're intending to do something good, you're not going to be held liable always, unless you have to. There's rigorous steps that you have to go through, like negligence, like intent to harm, etc., to be considered guilty of harming someone. But Good Samaritan laws in terms of administering naloxone, that was one that was recently passed. So
Naloxone is a overdose drug
for opioids, right? And yeah, I don't know, it's interesting too, because the Indian Health Service, so we had state and public and private hospitals, and then you also have Indian Health Service hospitals. And so those technically, a government hospital and an IHS hospital counts as its own sovereign entity. So it's a very different system if you're going to try and do malpractice suits through Indian Health Services. That's my limited knowledge. That's all my limited knowledge. I don't know. I was luckily never in that position, but
yeah. So I just have a question in general. You've lived in a lot of different places. You've spent a lot of time in different places. What enables you to do that? Because a lot of people, I don't think, are built that way, right? Because when we go to different places, we feel displaced, right? I mean, the people are different than us. The languages are different than us, and some are different than the ones that we speak in some cases. The cultures are vastly different. So when you're going and when you're living in all of these different places, how do you adapt? Like, what tactics do you use to sort of ingrain yourself and make yourself a home in the areas that you're in?
So I think two big things are responsible for my being able to like sort of be a successful nomad. Yeah, it is hard. It's lonely, but I grew up bicultural, biracial. I don't even, my mother's from Mexico, my dad's from the States. They both look very different, but I grew up with Spanish and English, and never really fitting in. And so I think that despite that being terrible as a child and into my adolescence, and then even somewhat into my early 20s, it's actually proven to be like a gift, because I never fit in. So I'm more empathetic to people who may also not fit in. And you just kind of get used to floating. Sometimes it's hard. And then the other thing, which may or may not be appropriate to say, but my family, I don't really have a strong family background. There was, there's not a lot of cohesion. So I know that's unique to me. And so it kind of gave me more skills in terms of making my own family, right? And finding friends and trying to connect with people in different ways. So I've had lots of years of practice. So I think those things have helped. But yeah, for example, I've lived in mostly tropical places, Miami, Mozambique, California's Mediterranean, but still very, mild climate. But Alaska, like, you really have to, that is some special gear that you need, right? And a special headset or mindset. So you have to, I don't know, also cultivating strong mental health and self-care practices.
Yeah, yeah, absolutely. So do you see yourself continuing along this path of global health? And if so, like, where do you see yourself branching in the future? Like, will you be continuing to work with the CDC, or are you going to look into other organizations, non-governmental or otherwise? In like, where would you see yourself potentially working next? Because our fellowship is time limited at 3 years, and eventually it will come to an end. So what are the plans post fellowship?
That's a great question. So someone recently asked me about this, and I said, I love being a nurse and I love public health, but I don't know if government is like the best fit for me always. Alaska, I worked for the government during COVID. I mean, I worked for the government the whole time, but I was a little more autonomous, in Bethel, as a practitioner.
Mm-hmm.
But I've lost contact with patients and individuals, and I think that's really where healthcare, where you could, like you had said earlier, where you can do the most good, and where we meet each other as just regular humans and listen to each other. I'm not for politics.
Public health has unfortunately become exceedingly political in the COVID era. I understand that it's worn on all of us in the profession, for sure.
I know so many people have quit in public health, and I'm hoping it's just temporary, because they're really young people, like in their early 30s, right? That are like, I'm burnt out. I'm going to take a private sector job. Maybe I'll come back.
I understand and I empathize. I mean, being in the public eye, especially working for an organization like the CDC, which gets a lot of media attention, whether it be positive or negative. I mean, we're viewed as leaders in public health and, the public health community, the international health community. And, there's a lot of heavy reliance that certainly comes with that. I mean, on our opinions, not just to, governments like us working with the Dominican government, working with the WHO, working with, which is the World Health Organization, working with the Pan American Health Organization, but also dealing interpersonally with family members, right? I mean, because you've come to be this trusted source of information, and there's a heavy burden that comes along with that. At least I feel that way. So yeah.
I don't know. I've received just today, I think 3 texts from 3 different people in my life, some here, some in the States, with COVID questions. Someone's diagnosed with COVID and they're asking me what they should do with isolation, or what kind of test should I get? Is this medication available here? What should I, and I don't even think about it. So even in my personal life, I'm doing public health and nursing. And so if my job is also burning me out, I can totally see why people would want to quit. And then when you have people arguing with you, I had someone ask me about monkeypox and why inflammatory messaging was being sent out, but the CDC website didn't say that, they had misheard it, and you're just kind of volunteering your time constantly. And so you have to really love it. I think you have to really love public health if you're going to become a PhD or a clinical, have a clinical position or something. You really have to love it because it's going to take over. To a certain extent.
I think that a lot of people going into public health don't realize that messaging and communication is half of the job now. Like, you can no longer just be skilled in what it is that you do or knowledgeable about what you do. You have to
know how to transmit that information. Yep.
Exactly. If you can't effectively communicate it to people, you've lost the battle. Because we, as public health practitioners, we have no inherent jurisdiction, right? Like, there's no actions that we can take, whether it be nationally or internationally. I mean, the CDC has some power domestically.
We had to force quarantine in some places. Yeah, we had to force people off planes.
So domestically, we've got some power, but in the international realm, where we work, everything that we do is based on building partnerships. So we have no inherent authority, and we serve in an advisory capacity. So building relationships and effectively communicating is more than half the job. I mean, to be quite honest, is certainly more than half the job. Building those relationships is so important. And that can be really frustrating to people because you feel inept in some cases. Like, what you're doing doesn't matter because it's something that you work, really, really hard on, but doesn't get picked up, or, is advice that's not listened to, or the ultimate thing, really, I feel like, is being accused of being a liar or spreading disinformation, which is something that I had never grappled with before the COVID pandemic, which has become so highly politicized. But to be called a liar and part of the problem to your face is
that's those are personal attacks when you're kind of because you expect everyone to buy into the concept of science. That is a thing that exists.
I mean, that's a big part of public health too, is realizing that not everybody comes from the same perspective that you do. That's pretty much step one. But when you have a situation where people can't even agree on what is fact, it becomes very, very difficult to figure out effective means to communicate. I was talking to somebody close to me, and this was earlier on in the COVID pandemic, and we were having a discussion about masks or something along those lines. This was pre-vaccine, and I was giving, the valid information that we had at the time based on the science and the studies that were coming out. And this person who I was close to was essentially accusing me of being disingenuous or brainwashed or whatever the mainline conspiracy theory is at the time. But I asked them, I said, you've known me for however long you've known me for many, many years. You've been an important part of my life. I've been an important part of your life. Do you really think that and I was like, I've been training for this for the past decade or more. And I said, do you do you not trust me? Do you believe the people on these extreme websites or in these news organizations more than you would believe me, somebody who you know and you trust and you have faith in? And the response was, I trust you, but I don't trust your education. Schools are
oh, I have not heard this one. No.
well, essentially schools are the proposition is schools are brainwashing people into the liberal agenda, or I don't even know. But yes, and that's just a microcosm for right. Now that is my pup squeaking his toy. Charlie, cut it out. I just looked at him and he looked at me in the eyes and kept on squeaking his toy. Charlie, cut it out. Sorry, what was I saying? But yeah, that's just like a microcosm of the situation. Is, you know, it's yeah, I mean,
people need to be ready for that if they're entering public health, because it is not, and you don't always expect, you know, like I'm just randomly, I've been hanging out with friends before and someone's like, so do you believe in vaccines? And this is like me off the clock. And I'm like, I'm a public health nurse and I vaccinate children for most of the time. Like most of my work is that, yes. And then they're like, well, have you seen this 6-part documentary about how the CDC has fed us misinformation, blah, blah. And I'm like, excuse me, I'm just trying to live and hang out. Right. Can we not talk about this right now?
Well, it's gotten to the point where I don't even like talking about, I mean, I haven't ever, but I actively dislike talking about COVID.
Yes.
I'm not acting in a professional capacity. Like it's something I deal with every day. I look at COVID projects, COVID data, make recommendations, so on and so forth, all day, every day. And I don't want to do it in my personal life, and much less don't want to do it in my personal life where it's not going to be believed or it's going to be debated.
Exactly. There's a difference. Like I have very little time and energy left over to talk about COVID. And if you're asking for help, I'll give it to you if you're not going to be a jerk about it.
Yeah, right.
Yes.
I don't want to debate about it. Like, this is what it is. Like, this is the information that we have. Yeah. So
people die every day. So thanks.
Yeah. And I mean, my sister is a nurse as well, and she's worked in hospitals and COVID wards and seen patients die, right. Patients that she was watching and that she was caring for. Right. And I think it's even more of an insult to people who have actually worked in those hospitals, like yourself, dealing with patients who are coming in with COVID-19, seeing the suffering and the pain and the desperation and the death and all of these and all of the sort of repercussions that has on family members who weren't even able to come in and hold the hands of their loved ones while they died.
Oh yeah.
I mean,
I've had to make phone calls and tell someone, hey, because every day we would meet all of the doctors, all of the case managers, someone from the lab, someone from pharmacy. Every day in the hospital, we would round daily and we'd be like, how's Mrs. So-and-so? Okay, she's tanking. And then I'd be like, okay, whoever's the case manager, please call the family. And I'd have to call people and say, hey, she's probably going to get ventilated later today. So if you want to say anything, any last words, like you're going to have to call today, right?
And you just hold up the phone so they can talk to their loved ones at that point. Like they
usually have like one in the bed, but yeah, like they're like, oh, thanks for letting me know. And people are like, it's traumatizing. And then I think back to when I was a contact tracer just the year prior, before I was working in the hospital, and I would call people and say, hey, who are your contacts, so that we can notify them. And people were indignant and angry and like, why are you invading my privacy? And I'm like, oh, you should get the vaccine. They're like, it's fake, I don't want to do it. And then when I'm in the hospital, people are thanking me for giving them horrible news about somebody dying. And it was a real, my mind couldn't like handle the disconnect.
Yeah, I certainly understand that. And the fact that you know, even, I mean, the vaccine, political issue for a lot of people. People won't take it based on their political beliefs, and that's been shown like across studies. I mean, people who are left-leaning are much more likely to be vaccinated and much more likely to also think that the pandemic is more severe than it actually is. So like they have an overblown perspective of what, you know, the pandemic is. And then people who are typically leaning right aren't getting vaccinated and underestimate the impact of the pandemic. So it's like, and this isn't just like a unilateral political position where one party is like overblowing things or anything like that, or it's across the political aisle. There's this tendency to become entrenched in the positions that you take. So in science, right, we're always constantly reevaluating our, assumptions. We're always going through the scientific method, changing guidance based on emerging information. But it seems like people in the general public just have their original positions, and then they don't move based on new information. And I think that there's no better example than people coming out and calling Dr. Fauci like flip-flop Fauci or whatever. It's like he's changing.
They don't understand the scientific process. Yeah,
exactly. Like you want us as scientists to be continually evaluating information. Like before 2020, nobody knew anything about COVID. It was a completely new, novel virus that's coming out. And of course, information is going to change as we adapt, as we learn more, as we try out different pharmaceutical and non-pharmaceutical interventions. So to become entrenched in one opinion early on and hold that continuously is foolish. Like it is very, very foolish. So I think that
I can see why people might be overwhelmed by having to keep up with so much information that keeps coming at you every day. It's tiring.
Yeah.
But to not be open at all is frustrating.
Yeah.
I have a question for you, because I wonder if this happened to you, because we both were in public health before this pandemic, and I found it really hard to explain to people what I did and what public health was. And then I remember it was 2020, and I was walking outside because everyone started, being outside and doing outdoor activities because it was safer than indoors. And I would just hear, it would be a 65-year-old couple, friends that looked like they were in their late teens, just different groups of people. I'd hear them jogging by. They're like, yeah, man. And, like the R not and blah, blah, blah. And like talking about these epidemiological concepts that, we had known about, but everyone else all of a sudden is using it. No one had ever used it before. And it was so surreal to me. And I don't know what you...
Well, yeah, that was certainly my experience too. It's like when I told people that I was an epidemiologist, they're like, oh, so you work with skin. And I was like, wait, where's that come from? And I'm like, oh, epidermis, which is skin for people listening who may not know. But I was like, no, that's not what I do. So yes, I always struggled to explain what I do and the implications of what it is that we do. But yeah, these advanced epidemiological concepts have become common vernacular in the United States.
Right.
Like even like dealing with like R0, for example, or basic reproductive number, most epidemiologists never work with that because that's an advanced concept in mathematical modeling. So to have that be like part of the American vernacular now is just like insane to me. But yeah, that part is actually great to me. Like in my mind, we have so many amazing educational resources out there now. Like information is available to you at the stroke of a keyboard or, click of a mouse. You can really learn anything that you want to nowadays, and you can have access to reliable information. But sort of the dual or double-edged sword is that has now been weaponized, right? It's been weaponized to spread misinformation or outright disinformation or just straight up lies. So it's like this beautiful technology that we have in the internet was just such a beacon of hope and light for so many people, making knowledge accessible and sort of de-elitizing like the upper echelon of society and spreading information. But now it's just been weaponized in such a unique and sort of insidious way, I guess, by a number of organizations. So that's what we're trying to do. Yeah, here at Intelligent Speculation is help people suss out what is true and what isn't. But yeah, sorry, what were you saying?
No, I'm in the same vein. Like that's what it comes down to is relationships, and like you have despite them disparaging your education, the people that we know, and it really comes down to face-to-face interactions or phone to phone, but people that you know and trust we have to talk to each other, and it's no longer just the internet. Like if you really want to actually convince someone or get them, I feel, at least for me, and maybe the same for you, like I have to talk to people. Just thinking about, I have random people texting me, asking me questions. And I, despite my own political stance or my own leanings, I don't care where that person's background is from. I will talk to them and I will give them the best information possible and hope that that creates enough trust that maybe they'll be able to see that, you know, there are facts and you can trust certain sources.
Yeah. I think another important component is coming into these things with an open mind, like not to like change like what is like, oh, my scientific facts are wrong or whatever. No, but like coming in
Right.
like from a perspective of like these individuals, they aren't like, they aren't deliberately coming in and trying to, you know, like be abrasive or you know, have these like misguided beliefs or something like that. Like there's something that's behind it. Like there's a system that supports like the information that they have and that they're getting. And it's important to realize that it's not the person that you need to attack. It's the system that's sort of supporting the information that they're getting.
Yeah, and just coming at them with respect and knowing that there is a belief system, you know, like with vaccine hesitancy, always asking them like, so is it a religious thing? Like, why don't you want your child to get this vaccine? What is it about the vaccine? What can I tell you about the vaccine that might change your mind? Blah, 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 and having a conversation.
Yeah, absolutely. Well, okay. I think that's probably a good place to stop on a nice positive message for public health communication. But did you want to say any last words, any last topics that you wanted to cover?
No, well, except to say we need more people in public health.
We do.
Because everyone's burning out. But if we can make a positive change, because there are a lot of people who went into earlier retirement. There are a lot of people who switched gears. And so if you feel like if you want a really challenging and creative and not boring career, public health is a really important field of work right now and always.
Yes, absolutely. I second everything that you say there. And there are tons of
congratulations on your new position.
Thank you. Thank you so much.
When do you start?
I start on August 1st. So for people who are listening, I'm actually starting a new position. I'm taking a faculty position at the University of Nebraska. So I'll be teaching epidemiology and global health there. So it's very exciting. But yes, so thank you. And thank you for all of your insights, and thank you for taking the time to come and talk through your career and your interests and everything with us. It's been very, very enlightening. So thank you, Donna Bean, and we will see you on the next podcast, and next episode of Thinking Critically. All right, thank you.